Africa's healthcare sector continues to face significant challenges, including insufficient infrastructure, a shortage of healthcare professionals, a high prevalence of communicable diseases, a rising burden of non-communicable diseases, and inadequate healthcare financing.
You see that the trend of disease is changing, so we have to adjust ourselves, not only King Faisal but the health sector in Rwanda.
To address these challenges, the continent needs a multifaceted approach.
There are reforms like decentralization of the health services, ensure that at the primary care level things are strong, at least the basics. People don't need to travel distance and they expend more they should to access the basic care.
Countries like Rwanda are taking the lead in providing solutions by implementing bold strategies.
We are increasing the type of people that are being trained so that we are not only training doctors, but we are training nurses and all the people that I have mentioned, the policymakers, the researchers, the innovators.
These strategies are gradually positioning Rwanda as a leading medical tourism destination on the continent.
There are a lot of African people who go all the way to Europe or India and spend a huge amount of money for their treatment. We want to cut that down.
Like many African nations, Rwanda has made significant progress in providing healthcare for its citizens. Recognizing gaps in the sector, the country has been working diligently to address them.
So you send people to go and train outside, they come back, but you keep sending patients outside to be treated outside. So it doesn't add up. We want, therefore, that to translate into growth of capacity here in our country in as many fields as we can. And therefore, our people and others from the region being able to get the services they need from us, from here, things we build here.
Many of these challenges were due to inadequate financing, a shortage of skilled healthcare professionals, and other systematic issues. Rwanda had to adopt innovative solutions to overcome these hurdles.
We start actually from a strong political will, whereby people need to be healthy before we ask them to work and become productive. So this is a strategic direction that was in our favor to ensure that the environment is compatible with health, people have access to care. There are reforms like decentralization of the health services, ensure that at the primary care level things are strong, at least the basics. People don't need to travel distance and they expend more they should to access the basic care. So make sure that these were available closest to the communities. But also we had other things to sort out, like ensuring that people should be vaccinated. You have seen our numbers. The vaccination coverage is quite high for vaccine preventable diseases, and people who shouldn't die for conditions that should not lead to losing life. If you are going to, for example, to give birth to a baby, you are attended by a skilled healthcare providers. So this to maximize the health of the citizen.
Rwanda introduced significant reforms aimed at revolutionizing its healthcare system.
We have other reforms, the 5 reforms that were announced in 2023 around July. These are again to take us steps ahead in ensuring that the citizens of these nations are very healthy. That includes the 4x4 reform, strategic acquisition of equipment and medicine. For example, medicine, you know, the prevalence of NCDs is on the rise. People have cancers that require treatment that were not available or were available at a very high cost. So you package this access to medicine in a way that is affordable to the population that are in need. There is modernization of the emergency medical services, ensuring that people are reached to when they have an emergency in a very reasonable time. These are international standards that we should be able to assess ourselves against and work towards achieving what else has been done elsewhere. There's a primary healthcare reform which will take us step ahead. For example, 85% of the diseases now are treated at the community level. Diarrhea disease, simple pneumonia, malaria that is not complicated, but our overall goal is to reach to 95%. So we just push ourselves towards the most desired goal. There's of course, there's also the welfare reform, ensuring that medical professionals, healthcare professionals in Rwanda are working in a very good environment. We are able to retain them in their job, and they are able to be deployed and fulfilled at the level that is required.
One key reform focused on strengthening public health services and investing in healthcare infrastructure.
It was within our means to upgrade and invest also in these other hospitals that are called level teaching hospital. It was also in our means to do that, to operationalize that, because what they needed is a structure. Like, you are no longer a random hospital, you are a level 2 teaching hospital, which means you have responsibility to treat but also to teach. There are hospitals that would have new units set afresh or renovated, the floors changes, or you start from scratch if the service that did not exist.
And now we have an expansion project of increase the number of beds from 167 to 600. So it's not infrastructure only, it's not equipment only, it's even human capacity building.
Beyond infrastructure, the country has invested heavily in equipping hospitals with state-of-the-art medical equipment and introducing new technologies that are transforming Rwanda's healthcare landscape.
We are seeing an increasing of non-communicable diseases, and also with the increase of life expectancy, which is around 70 years. So you see that the trend of disease is changing. So we have to adjust ourselves, not only King Faisal, but the health sector in Rwanda. So that's why we have increased the number of specialties and subspecialties now. We are talking about subspecialties now. In medical, in surgical departments.
Another important reform was the 4x4 initiative, aimed at increasing the number of healthcare workers. Rwanda is working to exceed the WHO's recommendation of having at least 4 doctors per 1,000 people.
If you look at the density of the health workforce in Rwanda, we are at 1.2 per 1,000 skills professional. It means you have added your nurses, your midwives, your medical doctors all together, and you make a ratio based on the population size. We are at 1 to 1,000. The minimum required to tell that a country is resilient and sustainable is 4. So we are 4 times less than what we should have. Literally, it means whoever is there, out there working clinically, is doing a job that is meant to be done by 4 people. So 4x4 is there to answer that low density issue, to ensure that the services are delivered, accessible, the workforce is equitably distributed, not only focused in the urban cities, and they should also be in the rural area, because we have decentralized our services. The 4x4 concerns all cadres, medical doctors, nurses, midwifery, non-physician anesthetists, eye doctors, all the cadres should be embracing that reform.
We are increasing the number, we are increasing the type of people that are being trained, so that we are not only training doctors, but we are training nurses and all the people that I have mentioned, the policymakers, the researchers, the innovators, and also looking at equity. Our students also, we are trying to fill the gap of female practitioners, in that our medical schools, 3/4 of our intake are women.
These reforms have attracted both local and international partners, helping to establish a strong healthcare system in Rwanda.
Our support has been more on the equipping the training grounds of those future doctors or future health care practitioners, which is why we're building state-of-the-art facilities, we're equipping them, and we also contributing to the hospitals meeting standard of care that those students should meet, should find when they come to learn to be the best doctors of the world. That's one. And then our sister organization, the University of Global Health Equity, is training those next healthcare providers.
In Butaro, a remote area 100 kilometers outside Kigali, Partners in Health, in collaboration with the government of Rwanda, established the University of Global Health Equity. This world-class institution is training the next generation of African doctors, providing them with modern courses and innovations.
Here at UGHE, we train our students right from the beginning with the knowledge of being aware of where they are and who and why they are here. The patient and the community are our North Star. They are the ones who guide what we do. And the people with the knowledge is not some foreign experts or, or just textbooks, but they are the very communities where we are. They are the patients in the hospitals where we are. So our students are trained with that in mind and aware of that. We bring actually patients, we bring communities to be part of our trainers in conjunction with experts from, of course, from the, the health facilities, both in the district, in the whole of Rwanda, and also internationally. So there is that combination of filling a gap that was contextually missing in the way we trained, especially on the continent, where medicine, healthcare was a foreign product that was given to us to go and dispense. But this is context appropriate. And the training also, besides just the medical school, it is interdisciplinary. We have, we train nurses and midwives, we train policymakers, we train leaders that are already in, that are in service already, we train researchers, scientists, innovators, and we do this in partnership with both regional and international and local communities.
Adjacent to UGHE is the Butaro Cancer Center of Excellence, a referral hospital that has greatly improved lives of cancer patients in Rwanda and neighboring countries.
If our mission is to bring preferential care where it's needed most, and it doesn't have to be in the city, why not build a cancer center? So we embarked in that around 2012. And as we built, just the saying, say, build it and they will come, more and more patients started coming from even outside of the district of Burera. They started coming from neighboring countries of the Democratic Republic of Congo, Uganda, Burundi. Through different partnerships, we try to look at what can the patients where we work benefit from. And first it was equipping, bringing in state-of-the-art equipment for better comprehensive cancer care. So we had partnership that provided chemotherapy drugs, advanced chemotherapy drugs for patients. We had partners who built housing facilities for patients because, as you saw, it's difficult to find housing nearby, especially imagine now being on chemotherapy drugs. And we also now decided that we should collaborate with the Ministry of Health, and through the generosity of different donors, we bought a CT scan, which is the first CT scan ever in a rural area. We bought mammography equipment, which is also not a common equipment in that kind of setting. And then we also did realize that we have some young cancer patients who suffer mostly from kidney cancer. That's the most prevalent kids cancer or pediatric cancer that we have there. And sometimes they need a tumor removed, they need surgery, but we were not equipped for that type of surgery. So we found a partner who came in and is specialized in equipping surgery wards. So we collaborated with partners in health, building and renovating the facility, and they came in and equipped it so that the patient can benefit and so that the University of Global Health Equity students can come and train in a facility that's adequate for their training as future surgeons in the country. We're even hoping that next we can have more imaging equipment like radiotherapy, PET scan, so that if I'm a rural cancer patient, I don't have to travel to different regions of the country, so that my comprehensive care is taken care of.
The private sector is also stepping up, establishing healthcare facilities and contributing to the country's growing healthcare infrastructure.
A few years back in India, in our headquarters where we have a 1,000-bed hospital, the former ambassador to India from Rwanda was there and visiting our site, and also we had Dr. Laurent Mbanda, the Archbishop of the Anglican Church, visiting us. And seeing the project that we have there in India, they said, why not have this in Rwanda? So that is the time we thought, why not? But we were not sure. But it was in the year 2018, I think, that our team came here and we said, oh, what a beautiful place and a wonderful governance that we have. We should do this. So it was the vision of our Honorable Metropolitan Johann, the first Metropolitan of our church, who said we should do this. And that's how we are standing here right now, building a 220-bed multi-speciality hospital that can be a help for the people of Rwanda, not just Rwanda, but Africa in whole. As per our initial research, we found out there are a lot of needs, especially in the medical field, especially in terms of treatment, the facilities that can be provided, the number of doctors in terms of expertise, and a lot of professional courses that can be provided in this sector of health, which we felt was lacking. But using our expertise back in India, we thought, why not do this? So that is where we came up with this, where we want to start at least a 12-department multi-specialty hospital, departments like gastrology, cardiology, nephrology, where we can have full-time doctors that can help the people of Rwanda and Africa. At the same time, we were thinking to have a medical university where we can train young brothers and sisters who can become medical professionals at the highest level. What we have seen is there are doctors, but they need the exposure, they need the experience. That is where we step in. We will provide them with that experience and exposure that can help them further to help the medical facilities and the treatment of people here in Rwanda.
Beyond hospitals and medical institutions, new research and training centers are being built across Rwanda. One such example is IRCAD, Africa's first minimally invasive surgery training center.
And we started almost a year ago in October 2023. We opened up, and basically we're here to educate, elevate, and innovate. So we're here to educate surgeons in the latest techniques. We give courses that run between 3 to 5 days in all the areas of surgical subspecialty. And for instance, today we have an anesthesia course. And the idea is that, and we're specialized in minimally invasive surgery and robotic surgery. So we have one of the few surgical intuitive robots here in the sub-Saharan Africa. We're the only ones in this area on the continent. And also we are into innovation. So we have engineers here on site that work with engineers in France, and we're working to automate and innovate in the ultrasound technology as well as surgical techniques. We currently have an AI ultrasound project that's running a clinical trial in Masaka Hospital. We give conferences, for instance, we have oncology conference coming up in the new year, and we give healthcare related conferences, and these are always top level. We have an international faculty of over 800 experts that has been developed over the 30 years with France, and so we always seek the top expert in the world, no matter where they're from. If they're from Africa, if they're from Asia, if they're from North America or Europe, we have those experts available who come on site to give lectures, or they give them by video conference. We also transmit live surgeries.
Rwanda's advancement in healthcare have made the country an attractive destination for medical tourism. Patients from across Africa and beyond are now seeking world-class healthcare in Rwanda's modern facilities.
Most of the patients that we receive now are coming from the East African countries, neighboring countries mainly, but also we are seeing patients coming from even some central part of Africa and Western Africa. We had some patients from Republic of Central Africa, from Gabon, from Chad. Some of them in East Africa, they are Burundians, Congolese. All of those are coming to seek some specific, especially surgical treatment, like neurosurgery, spine surgery, oncology, cancer. They come here, and then even for investigations, some imaging like CT scan, MRI, and then for cardiac as well, cardiac diseases, because we have, among other programs that we have started to do some cardiac surgery procedures in pediatric and adults, but also we have started kidney transplant surgery.
I came here to seek medical treatment. There were specific medical tests I wanted to take, which were unavailable in Bujumbura, my hometown. I had heard that these tests could be done here in Rwanda, so I decided to visit King Faisal Hospital. I was referred to Rwanda by people who had sought similar treatments here, as they were unavailable in Bujumbura.
Recognizing the potential of medical tourism, Rwanda has developed a strategic plan to fully capitalize on this opportunity.
If I'm from Cameroon and I'm choosing between Paris and Rwanda to do things like endoscopic ultrasound, I will come to Rwanda. It's visa-free. I don't need visa to go to Rwanda. It's closer, it's cheaper, and the quality is comparable, if not better.
We have been given a mission of positioning ourselves not only in Rwanda, but also positioning ourselves in Africa, and deal with, as you see, there are some treatment modalities that require to go abroad. So we are trying to start the programs here and also attract patients. Instead of sending, trying to attract patients to come to us. We are going to expand the hospital, so increase the capacity. By increasing the capacity, we are going to expand the existing services, but also introduce new services. So, and also have qualified staff. So that's why the expansion goes with training.
Rwanda positioning itself as a medical hub is indeed the vision for UGHE, because the wider vision, the bigger picture, is that UGHE trains healthcare providers who are going to radically change the way healthcare is delivered in Rwanda, in the region, in Africa, and internationally, by the way we train, by the way we give services. So we are right in sync with what the government wants to do. We have one of the best simulation labs on the continent. There are only 3, and we are one of them. And this does not only serve UGHE, it serves the whole of the country. We have an innovation center that is now training fellows from the region about innovating in health. So we were right there at the cutting edge of medicine, so that we have solutions that are context again specific and right ahead.
We see this as a best option for medical tourism. We want to create this as a hub Why? Because there are a lot of African people who go all the way to Europe or India and spend a huge amount of money for their treatment. We want to cut that down. We want them to come to their own place, to their own continent, where they can get a good treatment and a minimal cost. Why? Because they save a huge amount of money by saving the travel cost. That amount can be invested in their treatment and they can get better treatments.
Kigali Health City is poised to be a game changer in healthcare provision, with several facilities already operational.
The complexity of medicine requires that you create an environment whereby you are updated and you are accessible easily. That's how who is neighbor of who in that Kigali Health City is not by coincidence. If you find the cardiac center next to IRCAD, next to the University of Kigali, it's not by coincidence. It's just meant to be that way. Soon we find also other infrastructure like National Laboratory, which is upgraded, FDA, which is the regulator, at the way that is upgraded. There is a high-level isolation unit for a center of excellence for high-level isolation unit for infectious disease of high consequences, because it goes with research, it involves clinicals, and also it involves the conversation of the caliber of the people who are to work in that city. You will also find the relocation of the University of Rwanda, College of Medicine and Health Sciences, because you cannot have these great services and you leave behind the trainees who should be able to see and access, because they're the one who to take it forward. So they will be also in that valley. You will also have a very significant presence of the private sector at specialized and super specialized level. The robotic surgeries, things that we used to dream that they are very far away, you are able to bring it not only in the city, in an ecosystem that is very well thought and accessible to trainees to take it forward and make it sustainable.
These government-led initiatives have significantly reduced the number of patients seeking treatment abroad, as Rwanda continues to invest in solidifying its position as a regional healthcare leader.
It all comes to knowing yourself, like know your data. We knew that there are three main reasons that will take Rwandans out of this country to seek treatment abroad, as you said, and these were cardiovascular disease, cancer care component, and also transplant medicine, like renal transplant, liver transplant, and so forth. And once you know that those could still go outside if you don't do something, and that's something that is within your means, because when they go out, there's a lot of money that go with it. So it's now up to you to reorient or reorganize the house to ensure that the treatment is not only available for those who would go outside, but also it's easily accessible for all. Today, not only we do transplant in Rwanda, but also where this transplant is done, there are Rwandans, specialist surgeons who are learning to take it over for sustainability of it.
By addressing the challenges facing African healthcare, Rwanda is proving that it is possible to build a resilient and equitable health system that benefits all its citizens.